Hello, this is Dr. Stephen Feldman. I'm professor of dermatology, pathology, and public health sciences at Wake Forest School of Medicine. I'll be discussing long-term efficacy and safety of Ixekizumab for the treatment of moderate to severe plaque psoriasis sustained for 3 years. Results of a randomized controlled phase 3 study, Uncover 3. The poster was presented by Dr. Leonardi and colleagues at the 76th annual meeting of the American Academy of Dermatology on February 16 through 20, 2018 in San Diego, California. To summarize, this efficacy and safety of Ixekizumab in patients with moderate to severe psoriasis has been demonstrated previously over 2 years. This trial, which utilized the labeled treatment schedule of Ixekizumab, demonstrated sustained efficacy over 3 years while maintaining a favorable safety profile. Importance: these results provide reassurance as to the long-term efficacy and safety of Ixekizumab in the majority of patients with moderate to severe psoriasis. Methods: the trial included adults with a Psoriasis Area and Severity Index, or PASI score, greater than or equal to 12, affected body surface area, or BSA, greater than or equal to 10%, and static physician's global assessment, and SPGA, greater than or equal to 3, at both screening and baseline visits. Prior treatment with etanercept was not allowed. At week 0 and through week 12, patients were randomized 2 to 2 to 2 to 1 to receive Ixekizumab 160 milligram loading dose, then 80 milligrams every 2 weeks, or Ixekizumab 160 milligram loading dose, then 80 milligrams every 4 weeks, or etanercept 50 milligrams twice weekly, or placebo. After week 12, all patients received Ixekizumab 80 milligrams every 4 weeks through week 156. After week 60, the dose could be adjusted to Ixekizumab at 80 milligrams every 2 weeks at the investigator's discretion. Key findings: 1,346 adults with a mean age of 46 years, approximately 70% men, were included. At baseline, the body surface area ranged from 28% to 28.6% of the body covered with psoriasis. PASI score ranged from 20.7 to 21.2. The SPGA score ranged from 3.5 to 3.6. And the Dermatology Life Quality Index score across the different groups ranged from 11.5 to 12.7. At week 156, a PASI 75 score was achieved in 93.7% of observed cases, PASI 90 in 81.1%, and PASI 100 in 56.1%. An SPGA score of 0 or 1 was achieved in 80.4% of the observed cases, and SPGA of 0 or clear in 56.5%. 86.4% to 88.5% of patients had greater than or equal to 1 treatment emergent adverse event. 43.1% to 50.0% were of moderate to severity. A serious adverse event occurred in 10.8 to 19.1%. Infections remain the most commonly observed adverse events, and viral upper respiratory tract infection was the most common, occurring in 25.3% to 29%. Grade greater than or equal to 3 neutropenia was observed in 0 to 1.1% across the groups. Here are my thoughts and analysis of this study. I am old enough to remember when TNF inhibitors were approved. They were revolutionary. I thought I'd never see another quantum leap forward like that. Then the IL-17 drugs came along, and they are so effective, and they seem to come with very minimal safety baggage. Those of us who care for patients with psoriasis are blessed and spoiled. How do the results of this study impact the current state of patient management? Based on the mechanism of action of IL-17 inhibition, we don't expect major safety issues. Perhaps we might expect an increased risk of candidiasis. Each year of additional safety data gives me more and more confidence that we do fully understand the safety profile of these drugs, and it looks terrific. How do the results of this study impact the future state of patient management? Clearly, IL-17 antagonists will play a major role in the management of patients with moderate to severe psoriasis. What questions remain unanswered? Longer follow-up will still be nice to have. I feel very confident after 3 years of follow-up, but I'll be more totally confident after we see the 5-year outcomes. The other issue is how well IL-17 antagonism compares to IL-23 blockade. Both seem very effective. Right now, IL-23 blockade seems to require fewer shots and may have less risk of exacerbating bowel disease. But IL-23 blockers are so new, it's hard to say with any level of certainty what the full side effect profile will be.